weeks from Thanksgiving, and you mentioned the possibility of another surge after Christmas and these upcoming holidays. Would you say we are at this point past the post-Thanksgiving surge, or are we still seeing the impact of those gatherings and travel in the numbers that are being reported?
Well, I think we're still seeing the impact of that. I mean, we reported almost 10,000 new cases today. It takes time for people, the incubation period is 2 weeks, and then sometimes people develop symptoms. It takes a while to get tested, et cetera. So I think we're still seeing the impact in terms of Thanksgiving. I think it is critically important as we approach Christmas and New Year's that the people really listen to the messages that we're putting out there. I think it's critical that people stay home. I think that it's critical that people avoid large gatherings, but also small gatherings. I know that people want to see their friends and relatives on Christmas and New Year's, but now is the time really to stay within your household, to have social interactions on platforms like this, and to really protect themselves, their family, and the community from this virus.
And I don't know if you've had a chance to speak with Governor Wolf since we last spoke a couple days ago, but have you and he had a chance to discuss when you may get vaccinated, and do you plan to do so publicly? And would you recommend that he do so even after testing positive for the virus as recently as last week?
Well, we are speaking about that. I don't have any new information for you, however.
Next up is Scott Beveridge. Scott, go ahead and unmute yourself.
Yes, Dr. Levine, thanks for taking my question. There's a growing number of restaurants in the Pittsburgh area, southwestern Pennsylvania, that are defying the order for no indoor dining, and mostly it involves claims about there isn't any science or data to back up that their businesses are any more or less unsafe than Walmart or Target. What do you have to say to these people?
Well, first, I really think that they're really hurting themselves. They're putting themselves at risk. I think they're putting their staff at risk and their patrons and their customers at risk by having restaurants, indoor dining and restaurants open at this time. And I think it can impact the entire community. There is robust evidence for the last 6 months or more about the spread of this virus for indoor dining in restaurants. And so there are many articles that have been published both by the CDC as well as other academic articles. In the summer, we talked about evidence, particularly actually evidence that Dr. Bogan had collected in Allegheny County about the impact of indoor dining and restaurants. And so, I think that it's counterproductive to the public health of their community, of their county, and our state to do that.
Thank you.
Next up is Tyler Pratt. Tyler, go ahead and unmute yourself.
Hi, Dr. Levine. I have a two-part with a follow-up. With the vaccine on everyone's mind right now and healthcare workers getting sort of talk about plans that Pennsylvania and the health department has for unrolling this for the general public. Do you plan to work with CVS and our pharmacies like y'all did with testing to unroll it for the general public?
Sure. Our vaccine plan is on our website. And as we've been discussing for weeks now, there are 3 phases, phase 1, 2, and 3. And we're in the phase 1A now, which is healthcare workers defined very broadly. And then starting on the 28th of December, distribution through CVS and Walgreens to nursing homes and then other long-term care facilities. Phase 1B are frontline workers as well as those with particular risks, health risks, and et cetera, to COVID-19. Phase 2 will be vulnerable communities and other priority populations. And then phase 3 is the general public. I can't tell you exactly when that's going to happen. It really very much depends upon the production and manufacturing capabilities of the pharmaceutical companies and then how much vaccine we get. What federal authorities have been saying, Dr. Fauci and others, is that, we might anticipate the general public being vaccinated perhaps late spring. I guess it could be in the summer. That would be probably the best educated guess that I could give you.
I'll use my follow-up to dig in just a little bit more on that. I'm using more specifically, just trying to figure out how would the general public go about getting the vaccine. Could you talk about that? Go to a pharmacy? Do they have to go to a healthcare provider? Can you talk a little bit more about that process for the general public down the line that may not be on the website?
Sure, absolutely. So we plan to use all of those different methods to vaccinate the general public. Now, a lot will depend which vaccines we have. Again, the Pfizer vaccine has to be kept at minus 80 degrees centigrade, which is, very, very cold. And only certain hospitals and certain pharmaceutical pharmacy companies have that type of capacity. But the Moderna vaccine is much more flexible. And then there are two more vaccines in the early pipeline, the AstraZeneca and Johnson & Johnson vaccine. So we plan to contract with pharmacies, as you said, for distribution. We'll be working with healthcare providers, federally qualified health centers. We'll be having vaccination clinics. And so we really plan a widespread distribution campaign to be able to administer the vaccines to the general public.
Next up is Mike Gorsinger from CBS 21. Go ahead, Mike.
Hi, Dr. Levine. Thank you for taking the time. Wanted to first ask, how exactly is it being determined which hospitals are receiving the first dosages of vaccine, and then kind of how it goes down the line over these first couple of days where the vaccine is available?
Sure. There are 87 hospitals that are receiving the vaccine this week. Those are hospitals that have two requirements. I mean, you have to be able to, because it's the Pfizer vaccine, you have to be able to have storage requirements of minus 80 degrees centigrade. So ultra cold storage requirements. And it comes in trays with 975 doses. So you have to be able to do a lot of vaccinations very, very efficiently. And then the Pfizer vaccine next week, depending upon how much we get, we'll go out to hospitals as well that have those requirements. And then we're hopeful that the Moderna vaccine will be approved. That's today with an EUA, and then go before the full FDA and the CDC Advisory Committee. And so we are hopeful that we'll be able to also distribute the Moderna vaccine next week. Now, we don't know exactly how much we're going to get, but it's much easier to distribute and to store because it can be kept essentially in a freezer. And so there are hospitals, particularly in rural areas, that could not get the Pfizer vaccine, but will absolutely be able to get and then distribute and administer the Moderna vaccine.
Okay, any follow-up? All right, thank you. Next up is Sam Zern. Sam, go ahead and unmute yourself.
Hi, Dr. Levine. Thank you for taking questions. I'm curious at what point or at what phase people who are incarcerated will be getting the vaccine.
So individuals in correctional institutions as well as staff are in phase 1B. And that's available on our website.
Next up is Jim Melwork from KYW. Go ahead, Jim.
Hi. Follow-ups on two previous questions. The first one following up on Aaron's question about the governor testing positive and then getting a vaccine. What is the recommendation to people who have tested positive but are in line to get a vaccine?
The recommendation is to get the vaccine. So we don't know how long immunity will last. And it appears that the robustness of immunity might depend upon how serious the case was. That if your case was if you had more symptoms in a more serious case, you might have a more vigorous immune response. If you had no symptoms, that you might have a much less vigorous immune response, although those studies are still continuing. So the recommendation from the CDC is it doesn't make any difference whether you've had it or not. You still get the vaccine.
And I hate to belabor the point, but I'm going to follow up on Scott's question. You point to summer studies from the summer regarding restaurants, but there doesn't seem to be any direct evidence of widespread transmission from restaurants and gyms and in contact tracing. And there doesn't seem to be any data from restaurants operating under the occupancy restrictions that they've been under for several months. If restaurants are doing what we're saying they are as far as spread, wouldn't there be more obvious data on transmission from them recently being while those restrictions are in place?
Sure. There is national data and national articles about that. So I've been saying for a while now, when you have 9, 10, 11,000 new cases a day, our ability to do contact tracing and case investigation changes. So no matter how many people you have, there's no way that we can reach 10,000 people a day. So our ability to get very specific information about location, such as eating in a restaurant or being in a business, is for the most part not possible now. Whether it's in Pennsylvania or any state, or any large city, such as, for instance, Philadelphia. And so really our case investigations and contact tracing now are prioritized to congregate care settings, so to nursing homes and other long-term care facilities, to corrections that has been mentioned already today, to schools, and prioritized to seniors. So we're not able to get that type of data now because we're in our surge. But the data that we have, the data that's available throughout the country and the data that we've had over the last 6 months are valid, and it has been very clearly shown that restaurants serve as a significant source of spread, and thus the mitigation efforts that we put into place.
Next up is Barbara Barr. Barbara, go ahead.
Hi, Dr. Levine. Good to see you again. Let me ask you just to follow up regarding that last stage with community. A lot of seniors, I think, have had questions and are wondering whether they should contact their family doctor to set up an appointment to get the vaccine. Seniors in particular, what advice would you give them at this point?
I think that will be very important in the future. Right now, seniors who are not in congregate care settings will not be able to get the vaccine. Seniors 65 and older are in 1B, not in 1A. The seniors that will be getting the vaccine starting on the 28th are seniors in nursing homes and then other long-term care facilities. That's going to be accomplished by the pharmacy partnership that we have through the federal government with Walgreens and CVS. So we have chosen the Pfizer product for that mission, and Pfizer product will be dedicated to Pennsylvania to go to distribution sites for Walgreens and CVS, and from there, working with subsidiaries, they will be going to the long-term care facilities, to the nursing homes, to immunize the staff and the patients. Now, as we complete 1A and we're headed towards 1B, then we will be working out all those arrangements for vulnerable seniors and others with vulnerable conditions, frontline workers, etc., to be able to get the vaccine in phase 1B.
Got it. And if I may, just on a little bit of a different issue, there are reports coming out that there could be extra doses in the Pfizer vaccine. Any clarification as to whether that's okay to use or should be discarded?
Sure. So this is new information over the last couple of days, is that it's supposed to be have 5 doses in the vial for the Pfizer vaccine. But it appears that that there is more than 5 doses, that there's often enough for 6 doses, and potentially just came out with a recommendation is that the healthcare systems, hospitals administering the vaccine can use that extra vaccine. What they can't do is take vaccine from different vials and put it together. But if they have enough for another shot in that vial, the recommendation from the FDA is to use it. That is very good information, because then we can immunize more people.
Next up is Paul Go, Pittsburgh Business Times. Go ahead, Paul.
Hi, Dr. Levine. Thank you very much for taking the time. I wanted to talk to you a little bit about the timeline for deliveries. You mentioned that I think 16 hospitals in Pennsylvania have received the vaccine so far. And initially we'd heard that it was through to Thursday that the initial week delivery would be. Is that changed at all, or all the 70 plus that are hospitals in Pennsylvania, that are they going to get their vaccine today?
It's not today, by tomorrow.
Okay, because that's that's obviously a lot of hospitals to do, depending, and it's a big state. And then is that going to is there a reason for that that it took so long for the bulk of them to happen?
That was the distribution schedule from Operation Warp Speed. Again, our mission starts when the vaccine is delivered to, right now, the hospitals, and then we work with them, and they're working on that administration of the vaccine. Operation Warp Speed has complete control with the pharmaceutical companies, and then for Moderna with transportation companies in terms of getting it to where we tell them to get it to. Right now, hospitals. So that was their distribution schedule.
Next up is John Moser. John, go ahead. One more call for John Moser. Okay, moving on to Jeff Cole. Okay. Looks like Jeff Cole is not on. Next up is Shay Singley. Shay, go ahead and unmute yourself. No question from Shay. Okay, moving on, Nicole Brambilla. Nicole, go ahead and unmute yourself.
Thank you, Secretary, for taking my question. I appreciate your time and understanding that Operation Warp Speed is dictating much of our timetable. Do you have a rough estimate about how soon our residents in nursing homes might be inoculated with the vaccine?
Sure. That part of 1A will start on the 28th, so a week from Monday.
And any idea about, which sections of? Thank you for the follow-up. Which sections of the state might be receiving that first, and about how many? Again, recognizing that it's a moving target.
So we don't. Actually, they're going to be delivering the vaccine to CVS and Walgreens distribution centers, and then CVS and Walgreens are going to be working to bring the vaccine to the nursing homes to immunize the staff and the patients. So it's actually not our system that decides that; it is their system. Now we're hopeful that we're going to have the Moderna product for hospitals, and then half of our Pfizer product will be for that mission for the nursing homes. But we really don't know how much we're going to get. We get these estimates and then they change them a couple days later. It really depends upon the production manufacturing schedule.
Next up is Sam Rillen. Sam, go ahead and unmute yourself.
Here we go. Hello. I just wanted to follow up with a few questions just about distribution, a little bit about the logistics. So you said that 71 more hospitals were receiving the shipments today. Did you mean today, or is that the rest of this week? And just kind of for next doses, is that something that's going to be happening? I know at some point they talked about, getting weekly allotments. So are we going to see another batch of the vaccine coming on Monday, like for the hospitals that haven't gotten it yet?
Mm-hmm. So we anticipate that the remaining hospitals will get their allotment today. If it's not today, it'll certainly be tomorrow morning. We do anticipate weekly distribution of the vaccines. Again, Pfizer, and then hopefully Moderna if it receives its FDA EUA. But we don't know exactly how much we're going to get. We hope to find that out, as the week progresses. But all that is determined by Operation Warp Speed in the CDC.
And then, so does that mean, next week you guys will be getting new doses? Because is that going to at all come into play when it comes to how is it going to be made sure that kind of these rural hospitals are prioritized and kind of when they get the vaccine?
So we know we'll be getting doses of Pfizer. We don't know how much. And we anticipate that we'll be getting doses of Moderna, but that depends upon what the FDA does over the next day or so. But let's assume that it does receive its EUA. Then we do absolutely anticipate transportation and distribution of the Moderna vaccine. It's the Moderna vaccine with the less stringent refrigeration requirements that will be going to rural hospitals for the administration to healthcare workers there.
Next up is Bill O'Boyle from the Times Leader. Go ahead, Bill.
Thank you. Dr. Levine, I'm in Luzerne County. And as you probably know, we are seeing a marked increase in cases the last few days, even over the last week or so. Today we had 534, which is an all-time high for us by far. We had 480 some yesterday. Two questions. One, can you identify for us where the predominance of these cases are coming from? Are these just from community spread, or is there institutional? We are hearing there are high cases in our correctional facilities. We have SCI Dallas here. I have reached out to them. I've not gotten a response so far for them. Or can you just tell us why these numbers are getting so scaringly high in Luzerne County? And then I have a follow-up. Thank you.
Sure. I don't have specific information at my fingertips on Luzerne County, but I would say it's probably all of the above. We know we see cases in correctional institutions. We know that we see cases in nursing homes and other long-term care living facilities. The amount of cases that we see in those congregate settings is directly proportional to the amount of cases and community spread that we see in the county. So we know that there is widespread community transmission of COVID-19 really essentially everywhere in Pennsylvania, which is why we need people to answer the call and to work and stand united to stop the spread. Wear a mask, social distance, avoid large and small gatherings, really stay at home unless you have to go out. And when you're seeing the type of numbers you're seeing, makes it even more important.
And that leads me to my follow-up, Doctor. How frustrating, and I've wanted to ask you this question for a long time, how frustrating is it for you and your department and the governor to see that so many people just apparently are so reluctant to follow the recommendations to help push back this virus and are refusing to wear the masks, to refuse to stay at home or not congregate, and violate all the recommendations just about that you have put out there? How frustrating is that for you guys, and what can you do about it?
Well, I wouldn't say frustrating is the right word. I would say it's motivating, meaning I use people's questions and maybe not following the guidance as further motivation to continue to try to get the message out and to say it in different ways in different settings, so that people can people can understand. So, I've been in addition to being a practicing physician at Penn State Hershey, I've been an educator. I'm a professor at pediatrics and psychiatry at Penn State College of Medicine, and so I've been a teacher. And so what I'm trying to do is to teach people about about public health, about the seriousness of this contagious and dangerous virus, and how they can protect themselves, their family, their community, and our Commonwealth. And I will stay laser focused on that mission.
Our last question today is Patrick Abdallah. Patrick, go ahead.
Thank you, Dr. Levine, for taking my question. I had a kind of a two-part question for you. The first is there going to be a place on the state's website that's going to show us how many people have been vaccinated up to, a certain point? And the second question is
one at a time, if you could, because I end up forgetting this at the beginning. So yes, we're going to have a dashboard on our website with that information. That'll be forthcoming.
Thank you. And my follow-up is, what's the process for ensuring people get their second dose of their vaccination?
So critical process. We have a whole system arranged for people to, in terms of reminders, to make sure that they get their second dose. It's also really important that whoever's giving the first dose, the hospitals, et cetera, are part of that process in terms of reminders, and to make sure that people come back for the second dose. The second dose for Pfizer is after 3 weeks. The second dose for the Moderna is 4 weeks later. In addition, Operation Warp Speed automatically puts aside, and they store, we don't store it, they store exactly how many vaccines will be necessary for that second dose. So this week, we're getting 97,500 doses that we're administering of Pfizer. Operation Warp Speed is currently storing 97,500 doses, which then we know that they will ship at the right time for us to be able to give the second dose. The same will be for the Moderna, although it's 4 weeks later. And so, and then if people don't show up, then we have a whole system to recall them. So it's going to be critically important. It's complex, but it's going to be critically important people get those second shots, which will offer the very best protection. Any further questions? Any further questions? April, are you still on?
I believe that's all the questions for today. We will record this briefing and we will post it at the pacast.com. For any members of the media with additional questions, please feel free to contact our press office. Thank you.
Thank you all very much.